Hi everyone, this is Lingana Gulot, your pharmacy student. Today we are going to discuss about the routes of drug administration. So don't be late, let's get into the video. And today topic is about routes of drug administration. In pharmacology, the routes of drug administration refers to the method by which the drugs are delivered in the body to produce the therapeutic effect. And the choice of the route in a given patient depends upon the properties of the drug and the patient requirement. Here, the routes of drug administration are broadly classified into two types. First one is local route and second one is systemic route. And we go for the first one, local route. In pharmacology, the local routes of the drug administration refers to the method where these drugs are applied to the specific site or tissues to produce a localized and therapeutic effect. In local route, the absorption and the systemic side effects are minimal or absent. And in this local route, the drugs which are absorbed by the site and routes and that the same can serve as the systemic routes of administration. Example, glycerol trinitate which is applied on the skin as ointment or transdermal patch. Going to the type of local routes. First one topical route, second one deeper tissue, and third one atrial supply. So in topical route, it is refers to the external application of the drug to the surface used for the localized action. And in this, the drugs can be easily delivered to the localized lesion on the skin, oropharyngeal, eyes, ear canal, and vagina. And these are the drugs absorbed through the skin or mucous membrane to reach the target tissue or organs nearby, providing the localized treatment. And it is more convenient as well as encouraging to the patient. In the medication which are used in topicals are lotions, ointment, creams, powder, rinse, paints, drop, sprays, lozenges, and suppositories. Second one is deeper tissue. In term, the deeper tissue typically refers to the tissue located beneath the surface of the skin or the mucous membrane. These tissues can include muscles, tendons, ligaments, joints, and deeper layer of the skin. In deeper tissue, the deeper areas are approached by using a syringe and needle, and the drugs should be used in such form that systematic absorption is slow. Examples are intra-articular injection and retrobulbar injection. And second one is systemic route. The systemic route refers to the administration of drugs that are intended to be distributed throughout the entire body via bloodstream. This route also ensures that the drug reaches the systemic circulation, allowing it to exert its effect on various target organs tissues. So, the various systemic routes are classified upon their action and characteristics. We go and discuss about each and every one. So, first one, oral route. Oral route is the most common and oldest method of drug administration, and it is safer, more convenient, and often painless because it does not need any medical assistance. And it is also regarded as one of the safest route of drug administration. The largest surface area of gastrointestinal tract, the mixing of its content and difference in the pHs at different part of the gut helps effective absorption of the drug which are given orally. And the oral drugs are so cheaper because the medicament should not be sterile when we use through oral route. And oral route includes two types of dosage form. One is solid dosage form and second one is liquid dosage form. In solid dosage form, we use in the form of powders, tablets, capsules, granules, molded tablets, and gastrointestinal therapeutics. In liquid dosage form, we use elixirs, syrups, and emulsions. The advantages of the oral route are it is the safest route, most convenient, most economical, and drugs can be self-administered and non-invasive route. And the disadvantages are one set of action is slower as absorption needed time. And some drugs may not be absorbed due to certain physiological characteristic. Example, streptomycin. And there may be some irregularities in the absorption. Some drugs may be destroyed by the gastric juices. Example, insulin. And it should not be given to unconscious and uncooperative patients. The sublingual route of drug administration involves the placing of tablet or pellet under the tongue or crushed in mouth and which spread all over the buccal mucosa. So in sublingual, the absorption is relatively rapid in action and which is produced within the minutes after the drug administration. In sublingual, only lipid soluble and non-irritating drugs are administered. Advantages are the sublingual produce one set of action due to the direct absorption into the systemic circulation and higher bioavailability compared to the oral administration for certain drugs. The drugs which are given sublingual are the glycerol trinitrate, bifenonephrine, and desamino-oxytocin. Rectal route. The rectal route of drug administration involves the insertion of drug into the rectum for absorption into the bloodstream. The drugs can be administered rectally in various forms such as suppositories and enemas. Suppositories are the solid dosage form. that melt or dissolve after the insertion and results in the releasing of the drug. And enemas involves the injection of liquid preparation. Advantages are avoid first pass metabolism. The drugs absorbed via rectal route can bypass the liver function and increase the bioavailability of the drug. Second one is rapid onset. Some drugs which are administered rectally have faster onset of action compared to the oral administration. Disadvantages: inconvenience. It causes uncomfortable and unpreferable for some patient, and variable and absorption. Absorption rates can vary due to cofactors such as rectal pH, presence of feces, and individual mucosal blood flow. Is cutaneous. So cutaneous are the route of drug administration involves the application of medication onto the skin or mucosal membrane for absorption into the bloodstream. Types of cutaneous routes. So there are mainly two types. First one is topical and second one is transdermal. In topical routes, the drugs are applied directly to the skin surface. This includes creams, ointments, gel, lotions, and patches. Topical medications are absorbed through the skin and enter the systemic circulation, and this absorption depends on such factors such as skin thickness, hydration, blood flow to the site. And the properties of the drugs example includes lipophilicity. So the examples are corticosteroid for skin inflammation, antibiotics for skin infection, and local anesthetic. And second one is transdermal. So the transdermal drugs are delivered through the skin for systematic effect, typically via patches that continuously release the medication over a long period. And in these patches, that they are designed to deliver the drugs through the skin into the bloodstream at a controlled rate, bypassing the first metabolism in the liver. And here in transdermal, the nicotine patches for smoking cessation, hormones patches for contraception or hormone replacement therapy, and paid medication. Advantages are the it is a non-invasive. Generally, the cutaneous administration does not involve needles or invasive procedure, making it more comfortable for the patient. And target delivery. Topical treatment can be applied directly to the affected area, providing localized therapy. And second one is disadvantage. Skin irritation. Some drugs or formulation may cause skin irritation or allergic reaction. Variable absorption. Absorption rates can vary based on skin condition, thickness, and the specific drug formulation. Limited drug types. Not all the drugs are suitable for transdermal delivery due to molecular size, lipophilicity. Fifth one is inhalation. Inhalation is a route of drug administration where medications are delivered directly into the respiratory tract through the inhalation and allows for the rapid absorption into the bloodstream or produce the local therapeutic effect within the lungs. Type of inhalation devices. There are mainly three types. First one, meter dose inhalers. These are prescribed devices that deliver a prescribed dose of medication in aerosol form when activated by the patient. Second one, dry powder inhalation, and this is also called as DPI. This device delivers dry powder medications which are typically activated by the patient inhalation. And third one, nebulizers. Nebulizer converts the liquid medication into fine mist that patient can inhale through a mask or mouthpiece. They are often used for patients who have difficulty using MDIs or DPAs. Advantages: rapid onset. Inhalation allows drugs to reach the bloodstream quickly, making it suitable for treating acute conditions like asthma attacks. And second one, high bioavailability. Inhalation often results in high bioavailability of drugs due to direct absorption into the bloodstream. Target delivery. Inhalation delivers drugs directly into the lungs or systemic circulation without undergoing the first pass metabolism in the liver. And disadvantages. Device technique. Proper technique is crucial for effective drug delivery, and improper use can lead to reduce the drug efficacy. Potential side effects. Inhalation may cause local irritation in the respiratory tract or systemic side effect depending upon the drug and the dosage. Limited drug. Not all the drugs are suitable for inhalation due to factors such as molecular size, stability, and the patient's ability to inhale effectively. Examples of the drugs are bronchodilators, corticosteroids, antibiotics, etc. And sixth one is nozzle route. The nozzle route of drug administration involves the delivering medicines through nose, where they can be absorbed into the bloodstream or act locally in the nozzle cavity. Types of nozzle formulation. There are mainly three types: sprays, drops, powder. Sprays. Medications are delivered as a fine mist or spray into the nostrils using devices like nasal spray or pumps. Second one, drops. Liquid medications are administered drop by drop into the nostrils. Third one, powder. Dry powder medication can be insufflated into the nozzle cavity. Here, the nasal mucosa is highly vascularized, providing a route of rapid absorption of drugs into the bloodstream. Advantages: rapid onset. Nasal administration allow for relatively quick absorption of drug compared to the oral administration. Avoids first pass metabolism. Some drugs can bypass the first pass metabolism in the liver when administered nasally, enhancing the bioavailability. Local effect. Nasal press can deliver the medication directly to the nasal mucosa for treating conditions such as allergies or nasal congestion. Disadvantages: potential irritation. Nasal formulation may cause irritation or discomfort in the nasal cavity. Seventh one is parental route. The parental route of drug administration involves the delivering medication directly into the body by passing the gastrointestinal tract. Type of parental administration. There are mainly four types. First one, intravenous. Medications are injected directly into a vein. This method ensures rapid onset of action since the drug enters the bloodstream immediately, and it provides the quickest onset of action as drug directly enters the systemic circulation. Examples of drugs are emergency medications, chemotherapy drugs, and the fluids. Second one is intramuscular. Drugs are injected into a muscle where they are absorbed into the bloodstream through the muscle tissue. Absorption rate vary depending upon the factors like blood flow to the tissue. Here, absorption rate is generally faster than the subcutaneous rate due to the greater blood supply to the muscles. Examples are vaccine, antibiotics, and certain hormonal preparations. Third one is subcutaneous. Medications are injected into the layer of the tissue just under the skin. Absorption occurs gradually through the capillaries into the bloodstream. Comparing to the intramuscular, the subcutaneous route has lesser absorption rate depending upon the blood flow to the site. Examples are the insulin, heparin, and some growth hormones. Intradermal injection. Intradermal injection is a type of administration where medication is injected into the dermis, which is the layer of the skin just beneath the epidermis. The injection is typically given into the skin on the forearms, upper chest, or back, where the skin is relatively loose and accessible. The absorption is relatively slow due to the limited blood supply in the dermis. This slow absorption is advantageous for certain diagnostic tests, allowing time for the reaction to occur, and this intradermal injection may cause mild discomfort, redness, or swelling at the injection site, allergic reactions, etc. I hope everyone liked this video, so please like, share, and subscribe to Pharma Student.